Hi and welcome. My name's Christine Robinson. I'm the Principal Strategic Advisor with the Eastern Metropolitan Regional Family Violence Partnership. In this session, you'll learn how to decide which types of family violence supports may be useful to people and how to effectively access them. I'll be referring to information contained within pages 17 to 32 of the Eastern Navigation resource. Before I begin, I'd like to acknowledge the traditional custodians of the unceded lands that we're meeting on today. For me, that's the Wurundjeri people of the Kulin Nation, and I pay respects to elders past and present and any Aboriginal and Torres Strait Islander people that may be watching today. I also acknowledge that all people currently affected by family violence in their everyday lives, recognising that women have the highest risk of lethality from family violence. It is for these people that we're here today. The Regional Family Violence Partnership is a family violence regional integration committee. There are 14 across Victoria. These committees are local governance structures that provide strategic leadership to drive effective responses to family violence and support Victoria's family violence reforms. Our vision is for a society in which all communities and people are free from family violence. Before we can start navigating the resource, let's delve into what family violence is. The Family Violence Protection Act defines family violence as behaviour by a person towards a family member, a person with whom they have a family-like relationship that is either physical or sexually abusive, emotionally or psychologically abusive, economically abusive, threatening, and also coercive, or in any other way controls or dominates the family member and causes that family member to feel fear for their safety or well-being, or for that of a family member or another person. It also includes behaviour that causes a child to hear or witness or otherwise be exposed to the effects of behaviour referred to in these ways. Family violence does differ from other forms of violence. It is generally underpinned by a pattern of coercion, control, and domination by one person over another. While family violence can begin at the start of a relationship, it can also increase and change over time. There are times where there is an increased risk, and they include pregnancy and separation or attempted separation. Family violence is generally part of a longer term pattern rather than a one-off event. Intimate partner violence between current or former intimate partners is the most common form of family violence, with the violence generally being perpetrated by a man against a woman. Men can experience family violence and are more likely to experience violence in different non-intimate partner familial relationships, such as elder abuse. Intimate partner violence can also occur within a same-sex relationship. People from Aboriginal communities, as well as particular groups in the broader community, such as people with disabilities, LGBTIQA, SB+, people, and those of in culturally and linguistically diverse communities face particular risks and forms of violence and may also face barriers to accessing services and support. Older people may experience abuse along the continuum of behaviour recognised as family violence and can be particularly impacted due to limited service system recognition and fragmented responses. The Victorian Indigenous Family Violence Task Force defined family violence in the context of Aboriginal communities, and it's important for us to acknowledge that as an issue focused around a wide range of physical, emotional, sexual, social, spiritual, cultural, psychological, and economic abuses that occur within families, intimate relationships, extended families, kinship networks, and communities. It extends to one-on-one fighting, abuse of Indigenous community workers, as well as self-harm, injury, and suicide. The definition also acknowledges the spiritual and cultural perpetration of violence by non-Aboriginal people against Aboriginal partners, which manifests as exclusion or isolation from Aboriginal culture and or their community. So if you're listening to this video and using the Eastern Navigation resource, it's likely that you will fall into one of 4 MARAM workforce tiers. The MARAM Framework is a family violence multi-agency risk assessment and management framework. Professionals from a broad range of services, organisations, professions and sectors across Victoria have a shared responsibility for identifying, assessing and managing family violence risk, even where it may not be core business. Tier 1 workers are most likely specialist family violence, sexual assault and primary prevention practitioners. If you're from a tier 2 workforce, you're likely to be workers in core support or intervention agencies, including Victoria Police, courts, legal agencies and child protection. Tier 3 are workers in mainstream services and non-family violence specific agencies. While their core work is not family violence, they work in sectors that respond to the impacts of family violence, such as housing, alcohol and other drugs and mental health, or in an area where early signs of people experiencing or perpetrating family violence can be noted. And this includes the healthcare system, so GPs, community health, hospitals, therapeutic services and agencies that support financial security, such as Centrelink. Tier 4 workforce are those workers in universal services and organisations. Because they interact with children and families on their day-to-day role, like schools, childcare centres and faith-based institutions, these workers are likely to have regular and extended contact with victim survivors or people who use violence. If you fall into one of these 4 tiers, your organisation will be working towards aligning and embedding MARAM into practice. Please consult your organisation's policies and practice guides for local procedural guidance. So what do you do if you identify family violence? It's important you know the evidence-based risk factors, and they're embedded and you can find them in the MARAM framework. It's important to be led by the victim survivor. It's important to seek secondary consultation or referral with the specialist family violence service. It's important to share information, and your response should align to your level of responsibility under MARAM. Professionals from all MARAM workforce tiers have a responsibility to act if they identify the experience or use of family violence. However, this doesn't mean that all sectors will respond in the same way. Rather, each workforce should respond in line with the level of responsibility that they have been prescribed under MARAM. For example, workforces like AOD or mental health have an intermediate level of responsibility under MARAM. Because of this, clinicians in these sectors would complete intermediate risk assessment and support intermediate risk management if they identify family violence. On the other hand, professionals in a universal service like a school or a kindergarten have a different level of responsibility under MARAM and would generally contribute to identifying family violence, but would facilitate other service supports to access and manage risk as appropriate. The Family Violence Information Sharing Scheme allows authorised services to collect, use and share relevant information to reduce family violence risk. The Child Information Sharing Scheme is a place for authorised services. Professionals working with children and young people can collect, use and share relevant information to ensure the safety and well-being of children, young people and their families. So, specialist family violence services in the East. These services provide service to any victim survivor of family violence, their children, pets and animals. And our family violence sector in the East also provides services to men who want to end using their violence and other problematic behaviours in their relationship. The Eastern Navigation Resource provides details on pathways for victim survivors, adolescents using violence in the home, men's family violence or persons using violence in the home. It also provides pathways for gender diverse family violence responses and elder abuse. There are quite a few organisations providing specialist family violence services in the East. These are the Orange Door, EDVOS, Uniting, Bundawan Willem Aboriginal Healing Service, VACA, Refuge Victoria, Cara House, Women's Liberation Halfway House, Anglicare, Relationships Australia Victoria, and Link Health and Community. There are several entry points, one in particular for Inner East and then also Outer East and Melbourne. For the Inner East Orange Door, which is located in Box Hill, is the main entry point for people seeking family violence support and who are living in the suburbs and municipalities contained in Boroondara, Manningham, Whitehorse and Monash. The Orange Door is also the entry point for children and family services, Aboriginal services and for services for men who use violence. The Orange Door welcomes people of any age, gender, sex, sexuality, culture, religion, and ability. The Orange Door welcomes everyone regardless of migration status. You can seek help or support if you're a migrant or a refugee and do not have permanent residency. The details of that Orange Door are on your screen. The Orange Door is a support and safety hub, and by the end of 2022, there'll be 17 Orange Doors in Victoria aligned to the 17 DFFH areas. Currently for the Outer East Orange Door, to be located in Croydon, is due to open in April 2022. And this will then be the main entry point for people seeking family violence support and who are living in the municipalities of Knox, Maroondah and Yarra Ranges. For referrals and secondary consultations until then, please contact EDVOS, and their phone number and hours of operation are on their screen. The Eastern Navigation resource will be updated once the Outer East Orange Door is opened. Okay, these might be a little bit hard to read, but these flowcharts you'll find both in the Eastern Navigation resource. On the left, you have the flowchart for assisting a victim survivor of family violence, including children. If a client is in immediate danger, please contact police, then safe steps. If a victim survivor is not in immediate danger and there are options, then there are options. If the client you're working with consents or declines support to a referral to a family violence support service. Please note that both streams lead you to considering the Family Violence Information Sharing Scheme and secondary consultations. These are important parts of MARAM and also the Information Sharing Scheme legislation. The flowchart on the right will help you when you're working with a client who has been identified to be using family violence. Again, use of the Family Violence Information Sharing Scheme and the Child Information Sharing Scheme is important, particularly the proactive sharing of information with other family violence risk assessment entities. As mentioned, after hours or emergency support is available by calling the police on 000. Safe Steps and 1-800-RESPECT also have 24-hour helplines. The Men's Referral Service is also a great tool and resource to use for men who have used violence. Families, friends, and professionals can also contact them. For further navigation support, if you require additional support to navigate various parts of the family violence system, we encourage you to head to the RFVP website at the rfvp.org.au/service directory. It has other forms of navigation that you can have a look at, such as cold communities and also men who are experiencing family violence. Thank you very much. Head to the website if you need anything, and you can also contact the RFVP admin email address.